Hi, Grandma. I heard that you wanted to learn more about hypertension since it's something that runs in the family. You've been taking hypertension medication, as well as my dad, an Alipro, and my mom has been taking lisinopril. So, hypertension refers to the blood pressure or blood pumping in your heart. You have the systolic and the diastolic numbers. Systolic is the top number, and diastolic is the bottom number. Systolic refers um, to the pressure of when the heart contracts, and diastolic is the pressure of when the heart relaxes between beats. And for this, you use a machine or a manual machine called the sphygmomanometer, and this is how it looks like. Hope you can see it. So basically, what happens is you fill up the air cuff with air with this little pump all the way until you don't hear the heartbeat, and then you release little by little the air. And when you hear the first heartbeat, that's called the systolic number, and when you hear the last heartbeat, that's the diastolic number. So then you may ask yourself, what's the normal range for blood pressure? And that is 120/80 average. It varies with children as well, but right now we're talking about adults. And I have a little chart here of what normal prehypertensive stage 1 and stage 2 hypertension is. So you have here the normal, which is 120/80, like I said. Prehypertensive ranges around 125 to 85, more or less. And you see hypertension and stage 1 and 2 going a little bit higher. And the scary part about hypertension is that it's called the silent killer, and they don't get the name just for anything. If you don't control your hypertension, you can have a necrosis of the artery, aneurysms, nephrosclerosis, and those are just a few to mention. And this is a very good picture that I found of a little man with the complications of hypertension. You have here brain stroke, vision loss many times because of the pressure that is not relieved in the brain, atherosclerosis, kidney failure, heart attack. And we see a lot of patients in Driscoll with hypertension because of their kidneys as well. And how to prevent hypertension, that is easy. The first thing that is recommended is lifestyle changes, meaning less salt in your food, more water, exercise regularly, and avoid alcohol. And you need a diet rich in potassium and calcium. Most of the time, hypertension is usually caused by obesity, lack of exercise, diabetes, and if you add a lot of salt to your food. So if that does not work, you can also use drug treatment. A combination of drugs can help relieve the hypertension. You have the diuretics and the beta blockers and the calcium channel blockers. And diuretics are in the thiazide family, or also loop diuretics like Lasix can work to relieve the water pressure and the sodium in the body. A lot of kids in Driscoll with nephrotic syndrome and a combination of hypertension, the doctors usually give them Lasix, and Lasix is usually bought not over the counter. You need a prescription for Lasix, but for diuretics, you can buy it over the counter, and that can relieve the water in the person's system. And this is the picture of how diuretics looks. And then here you have the propranolol, that it's also used for hypertension to relieve the pressure in the brain and slow down also the heartbeats. That is another thing that propranolol does, aside from they also use it for migraines as well. And sometimes when one thing or the other doesn't work, doctors do combine medications, because sometimes one hypertension medication doesn't work. So they use a combination of two to relieve the hypertension. So I hope that I answered most of your questions, Grandma, and hopefully I'll see you next week. Bye.